Measles. You thought it was gone. Well, it's back. Welcome to Talking with Docs. I'm Dr. Brad Weenie.
I'm Dr. Paul Zalzal.
We have a guest today, Dr. Tom Warren, infectious disease. Tom, thanks for joining us again.
Happy to be here.
Dr. Warren is going to demystify a lot of the stuff around measles and why it came back, why it's a problem, and why you should give serious, thoughtful consideration to getting vaccinated if you're not already vaccinated.
So you mean Dr. Warren is in the hot seat, is what you're trying to say?
He is in the measles hot seat,
All
which...
right.
So Tom, in the media, obviously in Canada, US, and throughout the world, measles has making a comeback.
Yeah, it's always been around. It is one of those diseases where eradication might even be possible.
Right.
But it's just hard to get those last few people vaccinated.
Okay, what is the measles? Tell us about the measles.
So measles is a viral infection. Can present in a variety of ways with fever, rash, respiratory symptoms. Historically, often a disease of childhood.
Yep.
And can be prevented by vaccination.
Okay, and is it serious? Is it just a rash and it goes away, so who cares? Or are there any serious side effects that can happen with it?
There can be some serious side effects. There can be encephalitis.
Okay. So inflammation of the brain?
Yeah.
That sounds like a serious side effect if you're talking about serious side effects.
Yeah. There can be secondary bacterial infections, particularly respiratory infections.
Okay, is that because your immune system is kind of a bit compromised
That's
once
right.
the measles virus takes over?
Yeah, for weeks or even months after, your immune system just doesn't work as well as it should. And then
Not a good thing.
and people can die, certainly. There's been a lot of mortality in the past, for sure.
Okay, I read somewhere the mortality rate was 1 in 1,000 in like North America,
Yeah.
and much higher in developing countries, up to like 1 in 20. So 1 in 1,000 doesn't sound like a big number, but if thousands and thousands of people get the measles, then the death rate is thousands and thousands.
That's right.
Right.
And measles has been around for a long time. I think maybe first described even in the 800s.
Okay.
And I know, which is wild.
Wow.
And then kind of in the 1500s, they said, okay, well, this measles is kind of more of a thing. And then in the late 1800s, that's when Henry Koplik, the guy who identified the spots that show up inside your mouth, they're typical white spots that have a bluish tinge to them, show up 2 or 3 days after the infection. That was kind of the late 1800s. And then in the 50s, 1950s, that's when they actually identified the virus. And interestingly, the measles virus hasn't changed very much. And I thought to myself, well, why doesn't it change? Why don't like the little things, little proteins on the outside or the antigens, why doesn't it change? And they kind of described the effect, Tom, you can talk to this, is that because of the vaccine, it actually has less selective pressure to change a lot because it's pretty good at infecting people.
Yeah, that's, again, another benefit of the vaccine.
Right.
Yeah, the hit rate's like, they're 90%, right? 90% chance of getting
90%, yeah.
If you're in the,
If you're exposed.
If you're exposed, 90% chance of
And
getting.
because it's airborne, right?
Yeah,
So once someone's in, and it even can stay alive, I think, or in the air for a couple of hours after that person leaves the room, which is a huge problem, obviously, for us as human beings.
Yeah, it's one of the most infectious viruses or infections that we know of.
We've had guests like that. It's like, time to go, right?
Right.
So, and measles, and then there's German measles. That's a different thing, right?
Yeah.
Okay. And one is rubella.
And rubeola.
Rubiola is the German
measles.
Is measles, and German measles sounds close to it. Rubella, something.
Yeah.
It's like they're named real close. It's not good.
Yeah.
What are you guys thinking as microbiologists? You should have a broad spectrum of names. It's like your HPVs, 1, 2, 3, 4.
Yeah.
You got to get more
That's why we
creative.
change names of bacteria every few years, just to keep ahead of people.
Right? Because orthopedic surgeons get confused easily. You should know that by now.
Okay, so when it comes to the disease, it looks like a cold. So you get a runny nose, you get conjunctivitis a lot of times. You can have a dry cough that persists for quite a long time, and then these spots in your mouth called the Koplik spots, and then the characteristic rash that shows up 3 to 5 days later. That's kind of is that the hallmark? Like when if some doctor's calling and saying, hey, Dr. Warren, we have someone we're not really sure what they got, and like, this kid just developed a rash and they were 4 days out from this disease. You're like, yeah, now I'm thinking about measles.
Yeah, certainly the Koplik spots are very unique thing to measles.
Okay.
And then the rash and how it spreads is also quite typical. So it usually starts on the upper body around the face and chest, and then spreads downward to the rest of the trunk and then to the extremities.
And the thought of that is because the virus goes into your lungs and then into your bloodstream, and then because you have such a good blood supply to our head and neck, right? That's why it starts
That's right.
there and then kind of spreads peripherally.
That's
I
right.
thought it was gravity.
Yeah, well, kind of is, and I think blood supply kind of is a little bit of gravity too, maybe.
All right.
Okay, so now you know a little bit about measles, and maybe you've been exposed to someone with measles. Let's talk a little bit about vaccination and then what you should do if you actually have measles. Okay, so what's the role of vaccination in an area where you have access to vaccination?
Yeah, so measles is kind of the prototypic example of a great vaccine that works and saves millions of lives. It's been estimated tens of millions of lives have been saved because of vaccination for measles globally.
Right.
It's a very effective vaccine, particularly after 2 doses.
Right.
And it's really the best thing that we have to control the infection.
Okay.
It's recommended to be given as an infant and then again as a toddler, is that right?
Yeah, the first dose is usually in early childhood around 1,
Okay.
and then later on around 5.
Okay, so 2 doses of the vaccine.
Right. And so the vaccine originally started like in the 60s, like 1963, and that was a single dose, right? And then in the 70s, they said, well, maybe we should do 2 doses. And I think in late 80s for North America, that kind of became the standard of care. So the question that a lot of people are going to ask is, A, should I get vaccinated? For you, no brainer, right? This, unless you have an allergy to something in the vaccine, 100% we should be getting this vaccine, regardless of your thoughts about COVID and all the stuff that happened in the last 5 years. This is going to protect you and those around you primarily, correct?
Yeah, it's a serious disease that can be prevented, and it's a very effective vaccine.
What percentage are we talking about? Like how effective is, if you get 2 shots of the vaccine and you're not immunocompromised, how well does this protect you against getting measles?
At least 95%.
Amazing.
Yeah, that works.
Yeah.
It works. So you alluded to it, the measles, and then it got lumped in with the measles, mumps, rubella vaccine, MMR, and then it got implicated in autism because someone's going to be asking a comment now: does the vaccine cause autism? The answer to that, with no doubt, is no.
Yes.
The reason that it became affiliated with autism was because of an extremely flawed study that came out. Was it 98, I think? Wakefield study was 1998, published in the Lancet. It was 12 kids, not a random sample.
We
They
have a
were
video
actually
about this, actually.
kids that were ill.
Yep.
It was 12 kids. The author was funded by law firms that were suing the MMR.
And he was making another MMR vaccine.
He was making another independent measles vaccine.
Yeah.
So he didn't conclude that the measles vaccine is bad. He just concluded that you should give it alone and not with MMR.
Right.
That study was removed from the Lancet. It was redacted in 2010 because it was so poor. The doctor, Wakefield, lost his license. Now, in the scientific literature, there exists no scientific evidence that links the measles vaccine to autism. So put
To
that
the point where RFK Jr. even recommends measles vaccine now,
Does he?
despite writing a book about not having it.
Oh, really?
I think he went back and looked. Not all vaccines, but definitely measles. He's on board with measles.
Okay.
Yeah.
All right. So we get it. The COVID vaccine kind of mixed politics and science together. Your freedoms were restricted because of your COVID vaccine status, and that put a bad taste in everyone's mouth about vaccines. We apologize as a medical community. That was not handled perfectly. But please do not let that event affect your decision to immunize your children against measles.
Okay, so now that if you're still with us, despite getting frustrated by that because of the politics, let's talk about if you have measles, if you're exposed to measles, what should you do to deal with the disease acutely, Tom?
Yeah.
Say you are vaccinated. So say you're not vaccinated and you've been exposed to the disease and you're showing symptoms of measles. What should you do?
Yeah, see your doctor right away.
Right. Should you call ahead though?
Absolutely, yeah. So if you have measles, you're going to be very infectious.
Yes.
So as much as possible, stay away from other people, particularly larger populations of people.
Right. Okay, so you phone your doctor, you say, I think I've been exposed to measles. What is your doctor going to tell you to do?
It's going to really
Let's make a video visit.
Yeah. So the supportive care.
It's supportive care.
Right, so
yeah.
trying to deal with the high fever, because sometimes it can go up to like 104 or 40 degrees Celsius. So
Yeah, very high.
something to knock down the fever. Obviously hygiene and exposure protocols, and then just supportive.
Supportive care, yeah.
How
Hydration.
long is this going to last?
It shouldn't last more than about 7 to 10 days.
Okay.
If it does, if someone still has fever after that period, then that's when we think they might have one of those secondary bacterial infections.
Okay. So if you're sick with measles, so you're a day in, and you were not vaccinated, is there any role for you to talk to your doctor about considering post-exposure prophylaxis, or saying, listen, I wasn't really on board with the vaccine now, but I'm faced with the fact that I have measles. Should I get the vaccine now? If now, I'm open to talking about it.
Well, it's certainly a discussion that you should have with your doctor.
Okay.
Because it could still be something that's helpful.
Okay, and then so say I don't want the vaccine, is there any role for things like immunoglobulin and that kind of stuff? If I get really, really sick, say I develop encephalitis acutely because of the measles, is there anything else that can be done to help me?
Yeah, there are treatments like immunoglobulin,
Yeah.
but again, that's something that needs to be
Long
assessed
discussion.
with the doctor. Yeah.
So it's bad. So the best thing, if you haven't been vaccinated and you get measles, the most important thing to obtain is a time machine. Go back and get vaccinated, because prevention is the key. Prevention is possible. Prevention is safe.
Yep.
And we have the science that backs it up. So do get vaccinated. Now, again, if you haven't, now, later on, can you have problems in life after you've had measles? Like, how long after you've had measles can you still be susceptible to damage that may have been done by the measles?
Yeah, so there is a type of encephalitis that can occur many years after having measles.
The sclerosing one, right?
Yeah,
Is that you
that's
get
right.
scarring of the
Yeah.
lining of your brain.
That's right. Yeah, and it can occur many decades later.
Right, so you don't even know what's going to come. And
That's
then you're
right.
like, man, I should have had my vaccine.
So encephalitis sounds bad, because it is. What are some of the symptoms? Like, what is it? I mean, you know, swelling of your brain. So how does that manifest itself?
Yeah, so all sorts of neurological problems, whether it's problems walking or sensing or just
Anything
speaking.
related to the brain, essentially.
So your neurologic function can be, so this is, it doesn't happen to everyone who gets the measles, but it's one of the risks, one of the complications that can happen if you get the measles.
Okay, so we talked about the normal protocols, get it at 1 year and then get it about 5
The
years.
vaccine.
Yeah, the vaccine, sorry. And the delays because of an immature immune system. So as an adult, if I have not been vaccinated ever and I was going to get it, I get my first dose. My second dose comes maybe a month later, 4 to 6 weeks later, is that right?
Yeah, at least a month later.
Right.
That's right.
And how long after I get my first dose am I protected? And I'm like, oh man, thank goodness I got my vaccine this afternoon. I'm going to a clinic tomorrow to see my friend, and I know he's got measles, so I'm good.
No, usually about 2 weeks.
Okay, so
Yeah.
2 weeks to get up to maybe the low 90s, and then a month after the second dose to get up to
Roughly.
the mid to high 90s.
That's right.
Okay.
So we talked about what measles is,
Yeah.
right? How effective the vaccine is at preventing it,
Very
some of the complications that can happen,
serious.
and now sort of what's going on today. Is there an outbreak? How serious is the outbreak? How many people are getting it?
Why are we seeing an outbreak?
So,
Yeah, so we're seeing a lot of cases here in Canada,
Yep.
even. And what can happen is with international travel, there can be importing of the virus to from areas where it's naturally circulating
Yep.
back to areas here where there's high vaccination rates. But then it can spread if there's groups or pockets of the population where the vaccination rate is lower.
So it really is a global effort to try and eradicate this disease, because you can vaccinate one population, but if other populations in the globe that are accessible by travel, you're still going to have measles outbreaks. Because remember, the vaccine's not 100% effective, but it's very, 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 very effective at 95%. So that's the idea. That's why a lot of groups are working around the world to have vaccinations happen in different parts of the world, in developing countries as well.
And the answer in the past as well as now, the answer is get vaccinated. Okay, so guarantee there's going to be some comments, and please leave a comment if you had the measles when you were growing up, if you have thoughts about the vaccine, share them. Just be respectful is all that I ask. So say that you were exposed to the measles virus before vaccinations existed. Say you're 75 years old. You got measles in, say, the early 60s before vaccines. Do you have lifelong protection? Because someone's going to wonder, listen, I care about my health. I want to do my part for other people. Should I get vaccinated now, even though I got measles? That's my first question.
Yeah, it's thought that people born before about 1957 have been exposed.
Yes.
And if they were exposed, and most people born before that time were, then they're thought to have lifelong immunity. It's thought that natural infection provides lifelong robust immunity.
Okay, so they're good. Second group, if you're unsure of whether you got your second dose or not, if you're uncertain, you probably should get a booster dose. Is that fair to say?
Yeah, speak to your doctor, see
Yep.
if you can, determine what your vaccination records are, but that may be something that you need.
Okay, number 3, you're a healthcare worker in the middle of a measles outbreak, or there's measles that is increasing on the rise. You're in the ER, you're in these family medicine clinics, and you're worried that you're going to get measles even though you got your 2 vaccine. Is there any role for a booster for someone who is not immunocompromised but dealing with high-risk populations?
No, I
I
think
thought no, yeah.
no. Generally, it's thought that if you have a normal immune system, you've had 2 doses of vaccine, that
Yep.
you're protected.
Okay. When you are being exposed to these people, whether it's a family member or in a workplace environment, PPE gives us some protection, but because the virus is so virulent, this does not even guarantee it. So you could wear a mask and a shield and gloves and goggles, and you could still get measles in that room, because we were talking before the video, measles survives in a room for even a couple hours after that person leaves the room.
Yeah.
So you're really, other than isolating yourself, you really can't guarantee your protection.
No, like in a very controlled healthcare environment where we have rooms with negative pressure,
Right.
And the proper N95 PPE, we can really minimize that risk for
Right.
sure. But outside of those very controlled environments, it's such an infectious virus that it's very hard to control.
Okay, and then the last population, sorry, Paul, for people who are immunocompromised. So say you've had an organ transplant, you're taking medication, or you have HIV or some other disease that has really knocked down your immunity. The vaccine might not be safe for you because it's a live attenuated virus. What do those people do other than protecting themselves by trying to not expose themselves?
Yeah, so there are populations, like for instance, solid organ transplants.
Right.
Because they're on immunosuppression, they're not able to take the virus, as you said.
The
because
vaccine.
The vaccine, because it's a live virus. And so really in those scenarios, it's just
Be careful.
being careful and staying away from populations where there might be measles.
If you've had the vaccine before and then you become immune compromised, are you still protected to a certain degree or not?
It's unknown. We do have antibody tests that can measure the level of protective antibodies in the blood, but it does depend on a few factors.
All right, there it is. The vaccine it's not a new vaccine, like Dr. Weaning said. It's been around for decades. Therefore, there's been millions, if not billions, of people who've had the vaccine.
Right.
The clinical studies, recent ones, very good clinical studies, have looked at millions of people and tried to determine a link between that and autism. There is no link between the measles vaccine and autism. It is a very safe vaccine. It's very effective. Get it, because measles itself is fatal. It can kill you or it can give you lifelong disability. So it is, like we said, a no-brainer to get that vaccine. But we hope now you understand what measles is. You understand that there is a bit of an outbreak happening now in North America and around the world, and it is preventable and treatable to a certain degree, but some aspects of measles can't be treated and can still be fatal.
And just one last thing about the diagnosis. It's mostly about the history of exposure and the clinical symptoms. Like rarely do we ever have to do a swab or do a blood test or anything like that to determine that it is measles, because it's so obvious when you get the spots, when you get the rash, when you have the signs and symptoms, right?
Yep, and we do have good tests, PCR,
If needed.
serology if needed. Yep.
Right, but uncommon to ever do that. Now you know. If you like this video, please like it, subscribe to our channel, share it with someone that you think maybe is interested in measles, and definitely share it with people that you know that are not vaccinated against measles to help themselves as well as to help all the rest of us.
Share the info, don't share the measles.
There you go.
Remember, you are in charge of your own health.
We'll see you next time, and thanks to Dr. Gorn for
Thank
joining
you so
us.
much.
It's awesome.